Azasan, also known as Azathioprine, is a medication used to prevent organ rejection in people who have had a kidney transplant. It is taken with other medications to help the new kidney function properly. Azasan is also used to treat rheumatoid arthritis, a condition where the body's immune system attacks healthy joints. It is classified as an immunosuppressant, which means it weakens the immune system to help the body accept the new kidney or prevent further damage to the joints. It's important to talk to your doctor about the potential risks and benefits, especially for children and young adults. The daily dosage and optimal timing for taking Azasan will be determined by your healthcare provider. When taking Azasan, it's important to follow your doctor's instructions. Typically, you'll take this medication once or twice a day with food to reduce stomach upset. The dosage will depend on your medical condition, weight, and how well you respond to the treatment, so don't increase your dose or use it more often than prescribed. To get the most benefit from Azasan, it's best to take it at the same time each day. For arthritis treatment, it may take up to 2 months before you start feeling better, so be patient. If you don't see improvement after 3 months, let your doctor know. It's also important to note that Azasan can be harmful to an unborn baby, so if you are pregnant or may become pregnant, you should avoid handling the medication or inhaling the dust from the tablets. If you experience nausea or vomiting while taking Azasan, try taking it after meals to reduce these symptoms. Temporary hair loss may also occur. Make sure to tell your doctor or pharmacist if any of these effects persist or worsen. Serious side effects may occur in people using this medication, but your doctor has prescribed it to you because the benefits outweigh the risks. Your doctor will monitor you closely to decrease your risk. Contact your doctor immediately if you experience serious side effects such as diarrhea, new or worsening joint/muscle pain, symptoms of liver disease, or signs of a rare but serious brain infection called progressive multifocal leukoencephalopathy, PML. While a serious allergic reaction to Azasan is rare, seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects. If you notice any other effects, be sure to contact your doctor or pharmacist right away. And as always, consult your healthcare provider for personalized medical advice. Azasan, also known as Azathioprine, may rarely increase your risk of developing certain types of cancer such as lymphoma and skin cancer. This risk is higher in people using Azasan after an organ transplant and in children/young adults being treated for certain bowel diseases like Crohn's disease and ulcerative colitis. It's important to keep all medical and lab appointments and tell your doctor right away if you develop any unusual skin changes, changes in the appearance/size of moles, unusual growths/lumps, swollen lymph nodes, swollen abdomen, unexplained weight loss, or night sweats. Additionally, Azasan may decrease bone marrow function, leading to a low number of blood cells such as red cells, white cells, and platelets. This can cause anemia, decrease your body's ability to fight an infection, or cause easy bruising/bleeding. If you experience unusual tiredness, pale skin, signs of infection like a sore throat that doesn't go away, fever, chills, or easy bruising/bleeding, it's important to tell your doctor right away. Remember to take Azasan as directed by your doctor and discuss any concerns or questions about the medication with them. Before taking Azasan, it's important to let your doctor know if you have any allergies to Azathioprine or mercaptopurine, and to discuss any other allergies you may have. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. It's crucial to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, cancer, or certain enzyme disorders. Azasan may increase your risk of developing skin cancer, so it's advised to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Your doctor may also advise you to avoid phototherapy while using this medication. This medication may make you more susceptible to getting infections or worsen current infections, so it's important to stay away from anyone who has an infection that may easily spread. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's crucial to let your healthcare professional know that you are using Azasan before having any immunizations or vaccinations, and to avoid contact with people who have recently received live vaccines. To lower the chance of getting cut, bruised, or injured, be cautious with sharp objects like razors and nail cutters, and avoid activities like contact sports. Azasan can be absorbed through the skin and lungs and may harm an unborn baby, so women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets. It's important to discuss reliable forms of birth control with your doctor while using this medication. If you become pregnant while using Azasan, it's essential to talk to your doctor right away about the risks and benefits of this medication. This medication passes into breast milk and may have undesirable effects on a nursing infant, so it's best to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Azasan, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Azasan include febuxostat, certain cancer drugs like cyclophosphamide and melphalan, as well as other drugs that weaken the immune system or increase the risk of infection, such as rituximab and tofacitinib. It's also important to note that Azasan is very similar to mercaptopurine, so it's advised not to use medications containing mercaptopurine while using Azasan. Always consult with your healthcare provider for the best timing and proper daily dosage of Azasan. If someone has taken too much Azasan and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Always take the necessary precautions in case of an overdose. Now, it's important to remember not to share this medication with anyone else. Also, make sure you attend all your medical and lab appointments, as your doctor may need to do some tests like complete blood count, and check your liver and kidney function while you're taking Azasan. If you've had an organ transplant, it's a good idea to attend a transplant education class or support group. Make sure you learn about the symptoms of organ rejection, like feeling ill, having a fever, or experiencing pain around the transplanted organ. And if you've had a kidney transplant, watch out for a decrease in the amount of urine. If any of these symptoms occur, it's important to get medical help right away. If you forget to take a dose of Azasan, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take double the dose to make up for the missed one. Remember to store Azasan at room temperature, away from light and moisture. Keep it in a safe place, out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless specifically told to do so. When it's expired or you no longer need it, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.